So a great example of like this is medicine. So maybe there's a new drug in development and we want to compare it to the effectiveness of the old drug. That would be a positive control. And in a well-designed study like this, you'd probably have both. So you might have three groups. One group receives the new drug that you're testing. One group receives the positive control, the old drug that you know works. And one group receives a negative control. It receives nothing or it receives a placebo. And then you can compare that data really, really well. Now, I've said that word a few times, placebo. So we have two groups. One knows that they're not receiving, there would be no placebo if this was some other type of study. One group thinks that they are receiving the treatment, but it's actually just a placebo. So you have one group getting a placebo and no treatment, you have the other group getting no placebo and no treatment. And then there are many examples of the placebo group improving. You know, their pain goes away or they gain more muscle. There's lots of funny examples about this. And really, our psychology is very powerful. And that's why it's so important to use a placebo when we do a study like this. It's because we want to know what the difference the drug makes, not just the person's mentality and expectation of the experience that they will have, but we want to know if the effects of the drug add to